Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 81, Little Things That Can Make a Difference. Today, I will be discussing two actions that can be taken that would make life easier and save time for most people. One is related to healthcare and one is not. While the one change may not be the most important change in healthcare, it would save a lot of time and improve the accuracy of medical records. The second change will emphasize again that sometimes the government values companies over people, something in my opinion that happens too often. So let's get started. When I went on Medicare, I had to change doctors because the medical organization I used only had Medicare Advantage. And I knew that I wanted traditional Medicare with a Plan G standard policy. That is Plan G as in good. As an aside, if you want to know why you should choose traditional Medicare over Medicare Advantage, then listen to episodes 57 and 58. What you need to know about Medicare, Medigap, Medicare Disadvantage, and how Medicare for All benefits seniors. As I was saying, since I wanted traditional Medicare, I had to change doctors. This meant that I had to supply my medical history to my new doctor. My previous medical provider had a decent electronic health record system, or EHR, so I was able to download the information. However, I still needed to spend a lot of time manually filling out medical record forms for my new doctor. Of course, it didn't stop there. Every time I went to a new doctor or medical provider, I had to fill out new forms. So far, I have done this at least 5 times, and I will need to do it at least 2 more times. Each time, I need to check my records and fill out different forms that ask for the same information. This takes quite a bit of time and always causes me to see how many cuss words I know. It also wastes clerks' and nurses' time when they have to enter my information into their systems. The kicker came a few days ago when I went to a provider that I had been to before. They had deleted my records from their system because I had not gotten treatment from them. I had to get some other treatment before I started theirs. When I went back, I had to re-enter the same information again. This elicited some annoying comments under my breath. One of the clerks heard me and said to another clerk that patients had to sign their life away each time they come. If we had a centralized system, there would be no need to manually transfer medical data with all the potential for making mistakes. Time is saved and accuracy is preserved, and it would make it so much easier to change or see new doctors. There is a federal law that requires systems to be able to exchange health data by the end of 2022. I doubt that it will happen, and if it doesn't, I also doubt that the companies will face any serious penalties. So what caused this problem? While no one can say definitely, in my opinion, this is caused by EHR companies that want to protect their profits. If we had easy exchange of medical data, it would be easier to change EHR systems. Saying that it would be easier does not mean it would be easy, but it certainly would be more feasible. This problem, where we put the needs of companies ahead of the needs of people, is something that I think happens all too often in the United States. Here is another example. In some other wealthy nations, most people do not need to file a tax return. The government sends you a letter saying how much they think you owe. If you agree, you can just pay your taxes. Now, if you disagree or your taxes are complicated, you may need to file a return, but most people do not need to. Think how much time and money would be saved for most people. The federal government and states should be required to supply such a service in the United States. Of course, tax preparation companies have and would fight this. Again, this is another example of how the government often puts the needs of companies over the needs of the people. Of course, I think the most egregious example of putting the needs of companies over the needs of people is our current for-profit healthcare system. There is no quick solution to changing our government so that it puts the needs of its people first. It was Abraham Lincoln who said, "In government of the people, by the people, for the people, shall not perish from the earth." We need to get back to that, especially the part about for the people. The only way to do that is to start electing people who will do that. I urge everybody to support and vote for people who will do that. And if you can't find a politician who will do that, consider running yourself or finding someone who will and urge them to run. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.